Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Dr. Ann F. Creekmore. Dr. Ann is a licensed clinical psychologist for 40 years. She's a multifaceted therapist, and we'll talk a little bit more about that. And she's got a book that she's written that you can get now, and it's called Love Yourself, Love Your Life. Reading your background and seeing how many different types of modalities and types of therapy that you do for people with all sorts of different varied backgrounds. I'm eager to find out how you got there, but just kind of start off. Tell us, how did you become a therapist?
I was always interested. I mean, even in psychology, I mean, I know when I was like even like 12 years old, I'd be reading Freud and Jung, trying to analyze my dreams with Jung's dream symbols, interpretations. And I just knew I wanted to be a psychologist from an early
You
age.
work with people with varied backgrounds. It can be from a chronic illness, physical illness, to mental duress, or even social changes that people need to make. It just goes, it's in so many areas. I haven't seen a psychologist or a therapist that's able to work with so many backgrounds. How do you do that?
Well, like I said, that I do have an eclectic model, which does bring in most of the schools of thought in psychology, or the types of therapy that I enjoy
Hmm.
training in. I mean, I wouldn't be doing things unless I'd gone, to the workshops and done the training and the supervision. But I've done that. So I bring most of them um, in an eclectic manner when it's time, when it seems like if someone's being triggered, well, then we need to go deep and look at the wounds from the past. Or if they're having communication problems, we'll work on assertiveness training, on healthy communication, whatever it is.
Sure.
Reach from all of the training that I've had and just bring it in at that time. Um, I do hypnosis as well. When I was doing my internship way back when at the University of California, San Diego, I went out there, which was fun. And my supervisor did hypnosis. So, of course, that's what I learned, as well as doing all the
Mm.
therapy. So I've always included hypnosis. And I think that's an extremely effective technique. It's not like, Manchurian candidate, nobody's doing any torture on anybody. Sometimes people get a little afraid of hypnosis,
Sure.
but it's really you personally putting yourself into meditation. You put yourself in a little trance. I
Ah,
facilitate it by just saying, follow your breath and breathe in good, breathe out cares, and then go to a calm, happy water scene in your mind. And then when you get into that relaxed state, I give the positive suggestions from my kind of cheat sheet, I call it. We make a little cheat sheet of like maybe 4 things they want to work on. A lot of times it's
mm,
anxiety, depression, sleep, but it could be a certain phobia, or it could be, public speaking, it could be even procrastinating,
mm,
or lack of trust in relationship or flashbacks, whatever. And so that when they're in this relaxed state, the reason it works is because instead of their mind arguing with it, they're in beta, if they
hmm.
come in, they're not arguing with it. They're in this relaxed state, receiving it. And so if it fits with your value system, then, the suggestions that you hear, this positive, you thinking positive thoughts or whatever for the depression, then you'll absorb it. You'll be able to do it and self-actualize it. So it's just a really nice, non-invasive, natural, quick fix, really effective. I know that it's
Mm.
recommended to do it like 4 to 6 times, maybe weekly, but may work right away. Or if it didn't last quite the whole week, you boost it by
Sure.
15 minutes as part of the therapy. So I would call that one of my specialty areas, to always add that as an adjunct to, the other psychotherapy going on.
Mm. Now, looking at uh, your process and this intake, that's a lot of work. And do you have a cutoff on how many clients you would see in a day? Because if I'm thinking that you're working with so many different types of people with different issues. That's got to be tough on you. Do you have a cutoff? Do you see 3 a day, 5 a day? Can you go 7? How do you manage that?
Well, it would vary from day to day. Like if I had other things that I needed to do, you know, but I mean, I can see a lot of clients in one day and it doesn't bother me at all.
Hmm.
I mean, I feel better, I guess, feeling like I'm helping somebody. It's a positive thing. It doesn't drain me at all to do that. So I can go way over your number on one day a week, for example, and maybe at the top number the other days because I'm such a positive minded spiritual person. I just think that it's helping them and that brings me, I'm happier. Like I always tell them, that because they are doing good no matter what's going on. I mean, there are good things they've done. We just focus on the positive, and when they're leaving it's like, hey, you really did good with that, and you just feel free to call if you have something in between that you need me for, and people do that.
Wow. Dr. Ann, you have a gift. This is what you love to do. You love to help people. That's a
Absolutely.
real gift. Yeah,
Yes,
that is
thank
a real
you.
gift.
We are going to talk about many different things today. I'm going to be honest. It's going to be like a car swerving down the road. We're not going to hit anything, but we are definitely, we're all
Uh-oh.
over the place. Yeah, it's all good. But I guarantee you will have a takeaway in some regard. You'll start thinking deeper after we have this conversation. And we're having that with somebody who helps couples, individuals with therapy all the time. Many different things, many different realizations, really essentially for whatever you're dealing with. She's an amazing psychologist and she's got a number of books. This one's my favorite. They're all great. Love Yourself, Love Your Life. And we're going to not talk about one particular topic. I'm going to go to the glossary because a lot of these terms, you hear them come up all the time and you might think you know what they mean, but do you really? Dr. Ann Creekmore joins us today on the program. How are you doing?
Great, Steve. How are you?
Very well. I love thumbing through your book. And yeah, there's always something I take away. And I've said this before. This is like the manual for life. If you need to navigate life, relationships, all that, it's right here in the book on that. She is amazing in terms of psychology and the sessions that she offers people to realize these things, move their lives forward. She's also got some wonderful books. Life is good. Now, many of us will maybe dispute that at times in our life when we go through some challenges, and we all have them. But for the most part, life is good. If we see it that way, and we think it that way, it shall become that way. And we've talked about that before here, manifestation and the energy flows where the attention goes. We're going to talk about opening up to help, opening up to receiving what is good to those that want to help us. And it's actually chapter 4 in her book, which is called Love Yourself, Love Your Life. And she's back with us, an amazing psychologist with so much insight, Dr. Ann Creekmore. And I've said it before, the book, and you have a few, but that one in particular, Love Yourself, Love Your Life, it's really like your handbook for life.
I try to make it that way, right? Just to
Yeah.
have everything in it, from different schools of thought and different types of therapies in a little checklist form, so people can just use it for themselves for daily life.
I love what you do and the way you do it.
Thank you so much, Steve.
Yeah.
You too.
You're amazing. You really are. And
Thank you.
the book is just so easy to understand. If you're trying to figure out this thing that we call life or who you are, as we talked about, I am, check out the book or start a conversation. Thank you so much for being here today.
Oh, thank you so much for having me.
I appreciate it.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.